Everyone, welcome. In this lecture, I will talk about pulmonary circulation, especially its peculiarities and important relationship with clinical context. So, the regulation of pulmonary blood flow is actually occur by the changes in oxygen concentration in the pulmonary capillaries. And this change is actually quite different from most of the organs, because in case of pulmonary capillaries, if there is hypoxia or there is decreased oxygen level, it causes a vasoconstriction, which is quite different. And this vasoconstriction is actually occurs due to redirection of blood flow from the poorly ventilated hypoxic regions of the lung toward the well ventilated regions of the lung. So this is for the good of the body. And in case of fetus, the pulmonary vascular resistance is very high because of generalized hypoxic vasoconstriction. And when the fetus takes his or her first breath, the pulmonary resistance actually becomes much lower and the pulmonary circulation becomes much greater. So here we have a practice question. A 54-year-old male comes to your office complaining of daytime sleepiness and lack of energy. His wife mentions that he snores loudly and sometimes stops breathing while sleeping. The patient is at an increased risk of developing which of the following? So there are multiple options. You can pick one. Take a pause. Okay, I'm solving it. So the answer is here the pulmonary hypertension. Why is so? First of all, this male patient has daytime sleepiness, lack of energy, and stopping breathing at the night along with snoring. So this should tell us that this patient is having obstructive sleep apnea or simply sleep apnea. In case of obstructive sleep apnea, the patient have an hypoxia, a severe hypoxia along the night. So this hypoxia drives the vasoconstriction inside the pulmonary vessels, which causes pulmonary hypertension. If severe, if long enough, this pulmonary hypertension ultimately can lead to right ventricular hypertrophy and failure. We have another problem here. A pattern of finding graph below would be expected in which of the following organs? So here is a graph which is showing us the vascular resistance change with change in vascular blood oxygen content. So multiple options here. Very simple question. The answer is lungs. Why is so? As you can see here, when the blood oxygen level increases, the vascular resistance decreases. And if we go in the opposite side, if you decrease blood oxygen content, the vascular resistance actually starts to rise. So the vasoconstriction occurs due to decreased vascular resistance, decreased blood oxygen content or hypoxia. So hypoxic vasoconstriction. So this graph is actually depicting the hypoxic vasoconstriction, which is typical of pulmonary circulation. And now let's talk about the pressures and the cardiac output in the pulmonary circulation. So the pressures are actually much lower than the systemic circulation. Suppose the pulmonary arterial pressure is about 15 millimeters mercury. The resistance is also much lower in pulmonary circulation, which actually helps the circulation go away with a low pressure. And the cardiac output of the right ventricle is actually the pulmonary blood flow, which is equal to the cardiac output of the left ventricle and systemic blood flow. So here we have an equation for calculation of the pulmonary vascular resistance. So as we know that delta P is equals to Q into R. So meaning that the pressure gradients is equals to the flow and the resistance. So thereby resistance is equals to pressure gradient divided by the flow. And we can measure the pulmonary vascular resistance as PVR equals to pressure in pulmonary artery minus pressure in left atrium divided by cardiac output of the right ventricle, which is actually equal to the left ventricle. So here P pulmonary artery, which is the pressure in the pulmonary artery. Pressure in the left atrium is actually the pulmonary wedge pressure, and we can actually also measure the R by another equation, which is R is equals to 8 eta L divided by pi R to the power 4. Here the eta is the viscosity of blood, L is the vessel length, and R is the vessel radius, which is actually the most important contributor to the resistance. So now let's talk about the distribution of pulmonary blood flow. So whenever a person is supine, the distribution is uniform throughout the lung. But whenever a person is standing, now the gravitation or gravity starts to take place, and that's why the gravity is lowest at the apex. So the blood flow is actually lowest at the apex, and gravity is highest at the base. That's why the blood flow is highest at the base, which is called the zone 3. So here you can see the distribution of pulmonary blood flow. So distribution can be divided into 3 zones: the apex, the mid portion, and the base. The apex is called the zone 1, mid portion is called the zone 2, and the base is called the zone 3. So the blood flow is lowest at the zone 1. So that's why zone 1 has a low partial pressure of low pressure in the arterial system and high pressure in the alveolus. So in zone 1 the alveolar pressure is actually higher than the arterial pressure. In zone 2 the blood flow increases, and that's why the arterial pressure increases and it is over or above the alveolar pressure. In case of zone 3 the blood flow increases significantly. So this significant increase of blood flow severe increases partial pressure of increases the pressure in arterial system and also increases pressure in the venous system. So here in zone 3 the pressure in alveolus is the lowest pressure. So actually the graphical representation are written here. So in case of zone 1, which is the apex, blood flow is lowest, and here the alveolar pressure is the highest pressure, followed by arterial and venous pressure. And the high alveolar pressure can actually compress the capillaries and reduce blood flow in zone 1, especially in situations where the blood flow is reduced, like in hemorrhage, or if the alveolar pressure is increased, like in positive pressure ventilation. In zone 2 the blood flow is medium, because now the gravity is starting to take place, and that's why arterial pressure is now more than alveolar pressure. In zone 3 blood flow is highest, and because the zone 3 have the highest amount of gravitational force leading to highest pressure. So here arterial pressure is the highest pressure, followed by venous pressure, and alveolar pressure is the lowest pressure. So now let's talk about the right to left shunts. So in case of right to left shunts, this actually drives the deoxygenated blood bypassing the lungs towards the oxygenated blood. So there is actually mixing of deoxygenated and oxygenated blood, leading to a decrease in arterial partial pressure of oxygen. So this can occur in tetralogy of Fallot, and normally 22% of the cardiac output actually bypasses the lungs and actually causes a right to left shunt. And the magnitude of the right to left shunt actually can be measured by having the patient breathe 100% oxygen. If the patient breathes 100% oxygen and then we measure the dilution of the oxygenated blood by non-oxygenated or shunted blood, we can actually estimate the magnitude of the right to left shunt. Let's talk about the left to right shunt now. Left to right shunts are actually more common because the pressure in the left side of the heart is actually more, and those are usually caused by congenital abnormalities like patent ductus arteriosus, atrial septal defect, and ventricular septal defect, in some cases traumatic injury, and they do not result in a decrease in arterial partial pressure of oxygen. So that's all from me today. Thanks for watching my video.